Hi, my name is Devin Connelly, and I am a speech-language pathologist with Brenda Curtwright and Associates. Today, I would like to speak with you about self-advocacy and communication supports for individuals with diagnoses of mild cognitive impairment and dementia. In the presentation today, we're going to start by discussing an overview as to what mild cognitive impairment, or MCI, and dementia are. Next, we will discuss what self-advocacy is and how individuals can advocate for themselves. Third, we will talk about communication strategies and what people can do to support their loved ones with MCI and dementia. Lastly, we are going to hear from some current and previous cognitive rehabilitation patients about what self-advocacy means to them and what their families do to support them. So, what is MCI and dementia? So we're going to start with MCI. So MCI, or mild cognitive impairment, affects all areas of cognition, including memory, attention, language and word finding, and executive functioning. Individuals with a diagnosis of MCI experience increased memory or thinking difficulties than what's typically expected for their age. So talking a little bit about the causes and symptoms, there is no singular cause for MCI, but it has been linked to multiple etiologies, including brain injuries, strokes, brain tumors, and seizures, among other things. Common symptoms that individuals with MCI experience include difficulty coming up with words or word finding, forgetting appointments and events, losing things, having a hard time making decisions, difficulty following instructions, losing their train of thought, and difficulty following or remembering conversations. Overall, though, MCI difficulties are not enough to limit an individual's completion of daily tasks independently. So now we're going to talk a little bit about dementia. So dementia is an umbrella term for loss of memory and other cognitive abilities that are severe enough to interfere with daily life. There are a few different types of dementia, including Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. So let's dive a little bit deeper into what these different types of dementia mean. So we're going to start with Alzheimer's. So Alzheimer's disease is the most common type of dementia. It is a progressive disease that starts with some mild memory loss and eventually leads to more severe cognitive difficulties. Our next type is vascular dementia. Vascular dementia is a general term describing problems with reasoning, planning, judgment, and memory that's caused by brain damage from impaired blood flow to the brain. Our third type is Lewy body dementia. So this is a brain disorder that can lead to problems with thinking, movement, behavior, and mood. It's caused by abnormal clumps of protein that accumulate in the brain. Lastly, on this screen here, we have frontotemporal dementia, which refers to a group of progressive disorders characterized by the loss of nerve cells in the frontal and temporal lobes of the brain, which causes the lobes to shrink. So that's just a little bit about the different types of dementia. So like we just mentioned previously, the causes of dementia can vary based off the different types, but they do have some common general symptoms. So some of these common symptoms that individuals with dementia experience include severe difficulty coming up with words and communicating, asking the same questions repeatedly, becoming lost even in familiar places, having a hard time remembering familiar people, and then having difficulties with some of those daily living activities like planning and making meals, paying bills, keeping track of their calendar, things like that. Now we are going to talk a little bit about self-advocacy. So what does that mean? So simply put, it is the ability to speak up for yourself. Part of self-advocacy includes clearly communicating your needs, as well as clearly communicating what the people around you can do to support you. So specifically for MCI and dementia, it's explaining to people that you are comfortable with what difficulties you are experiencing and what they can do to help you with your difficulties. It's also really important to remember, though, that this is your private health information. So you do not have to share this with anyone that you are not comfortable sharing it with. So, why should people advocate for themselves? So, first of all, cognitive difficulties cannot be seen. Unlike a broken foot, someone can look at you and see your foot is broken, see you're going to have some difficulties. But cognitive difficulties cannot be seen. So in order for the people in our lives to be aware about what's going on, we have to tell them. We just have to communicate that to them clearly. Additionally, usually our family and friends want to help. They're just not really quite sure how. When we advocate for ourselves, we help them help us. And lastly, people with MCI and dementia deserve to be supported. You should advocate for yourself because you deserve that support. So let's talk about some examples of what self-advocacy looks like in terms of cognition. So let's say your friend keeps interrupting you, which is just making you lose your train of thought. Explain this to them. Tell them, every time you interrupt me, I totally forget what I was about to say, and it's making it really hard for me to have this conversation. Just clearly explain that to them and politely ask them, please stop interrupting me so that I can, get my thought out. So that's just one example. Another example, if you are making plans with a friend, ask them to send you a text with the information so you have it in writing as well. Don't try to put all this information in your brain when we can get it down in writing. Looking at our third example, you are talking, and if you just cannot come up with that word that you want to say, it's right on the tip of your tongue, ask your family, stop interjecting, and allow you to work through it on your own. A lot of times people do try to provide the word for us as they are trying to be helpful, but sometimes that can just make the situation more frustrating. So just politely explain that to them and ask for that time to work through the difficulty. Our last example here, you lose your keys a lot and your husband keeps moving them, right? Every time you come home, your keys are in a different space. Explain to him that you need to keep the keys in a certain place so that you always remember where they are. So you don't have to be looking all over. They're always in one certain home. So these are just some of the ways that people can advocate for themselves, but there are hundreds of other ways as well. So now that we've talked about self-advocacy, let's chat about what families and loved ones can do to support individuals with MCI and dementia. So first, when communicating, speak slowly and clearly. Maintain eye contact and reduce distractions in your environment. Facing each other and making that eye contact can make it much easier for your loved one to understand you and remember what you are saying. Managing the environment to remove distractions like maybe TV on or music in the background can help the individual with cognitive difficulties pay attention to the conversation and then remember that conversation a little bit easier. We also want to remember to be specific in what we are saying and rephrase information when needed. For example, if you say something like, I'm really not sure what to make for dinner tonight. Your loved one may not understand what you are saying. Instead, rephrase it to be more specific. I don't know what to cook for dinner. Do you want anything for dinner? Asking that direct question, being specific, is going to make it easier for your loved one to participate in that conversation. Oftentimes, individuals with MCI and dementia experience word finding difficulties when they cannot remember that specific word they're looking for. When this happens, it can be embarrassing or frustrating for the individual. Try not to talk over the person or throw random words at them. Instead, give them time to work through the difficulty on their own and ask them some guiding questions to help them find the word. Some examples of guiding questions include, what do you use it for? Where can you find it? What does it look like? This allows the individual to explain the word that they're trying to come up with so you guys can work together to find that word. Additionally, routines and schedules are very important for individuals with MCI and dementia. Try your hardest to respect these routines and schedules. But life does happen. Sometimes things do have to change. So if that does happen, try to give your loved one plenty of notice, plenty of warning, so that they can prepare for that change in their routine. So these are just some of the ways that family and loved ones can help support that individual experiencing cognitive difficulties. So these next few slides discuss self-advocacy and communication supports from the viewpoint of individuals with MCI and or dementia. So I have interviewed individuals that I've personally worked with to gain their perspectives on the following questions. What does self-advocacy mean to you? What are some things that you have done to advocate for yourself? And what are some helpful things that people have done to support you? So let's start with our first question. What does self-advocacy mean to you? So overall, individuals stated that self-advocacy was speaking up for themselves and asking for what they needed. But we do have 3 perspectives on this screen here, so I will give you a moment to read through these more in depth. Our next question was, what are some things that you have done to advocate for yourself? The ways that people advocate for themselves varies based on the person. Some people, in our examples here, ask for the accommodations they needed in the work environment. Some people choose to share the details of their difficulties and of their diagnosis with individuals around them so that they can understand a little bit better. And some people very specifically ask for help when trying to find words. So self-advocacy looks different for everyone. So again, I'll just give you a minute to read through some of our examples here. Our last question, what are some helpful things that people have done to support you? So I will give you a moment to read over some of the helpful communication strategies that these individuals, friends, and families have utilized in order to aid that individual experiencing cognitive difficulties. Lastly, I have included some family advice from a loved one of an individual with cognitive difficulties. She noted that the most important thing is to make sure that your loved one is as involved as possible in all decisions and appointments. A lot of times the individuals with memory difficulties can get overlooked in these situations, so it's very important to make sure that they're as involved as possible. She also noted that it's important to remember that your loved one is going through a very disruptive change in their life. And it's frustrating for all parties involved. But in order to get the best outcome, it's important to work together through this difficulty. Again, I'll give you a moment to read through the details a little bit more specifically. Thank you very much for listening to this presentation today. I hope that you found the information very informative. If you have any questions at all, I welcome you to please comment below and we will address your questions. Thank you so much.